Good morning, and thank you all for being here. My name is Neil Sharma, and I'm the CEO of DEG and the co-chair of KC Rising. Today, we are looking to give you the straight talk on vaccines for employers and human resource professionals. For the past few months, we've been hearing messages that when the COVID-19 vaccines are ready, we will see real progress in containing the virus. Progress that will hopefully mean connecting with loved ones, getting our kids back in school, and getting our workforce back in the workplace. Getting this virus under control means we can do the hard work to get this economy back on track, not just for a few, but for everyone. The last time we assembled all of you to discuss the pandemic, I said to my fellow business leaders on the call that no one expects you to be perfect. Making new decisions or even walking back others whenever you are presented with new information is not indecisiveness. It is thoughtfulness. You don't have to have the answer to every question. Sometimes the right thing to do isn't absolutely clear, but I will say that often the wrong thing to do is. Your people do expect you, by word and by example, to lead, offering common sense perspective, priority, and hope. To do so, you need to be armed with the best information, and you will undoubtedly have big questions of your own. So today, we turn to the experts in human resources, employment law, and similar areas for guidance on the vaccines. Thanks to our friends at the Society for Human Resource Management of Kansas City for providing their expertise today. KC Rising is proud to be a part of today's event with our sponsoring organizations, the KC Chamber, the Kansas City Area Development Council, the Civic Council of Greater Kansas City, and the Mid-America Regional Council. KC Rising began after civic leaders from these organizations realized that Kansas City was not recovering from the Great Recession of 2008, as well as cities similarly situated. As we approach the recovery from the impact of COVID-19, we are committed to not only recovering, but to rising stronger and emerging better than we were before. And we can only accomplish that if we do so together. There's nothing like a literal virus that is passed from one person to another person to prove the axiom that we are all in this together. We are all in the same boat. One of the things that makes our city, which I often call the biggest small town in America, so special is our business community's willingness to collaborate and work together for the entire region. After the events of the last several months, we need that unity now more than ever. We need that leadership now more than ever. In the spirit of true KC collaboration, I'd like to now welcome Joe Reardon, President and CEO of the KC Chamber.
Thanks, Neil. It's great seeing you this morning, and it's great to be a partner and a collaborator with you, and we appreciate your leadership greatly. Here at the Chamber, we've spent the last 11 months working to help businesses navigate the pandemic. And a big part of that was making sure that they had the resources they needed to move forward. Whether it's access to relief funds, a guide on how to create a safer workplace, or webinars on how to manage a remote workforce, we've worked to provide tools to employers when they needed it the most. Today's discussion on vaccines is another critically important tool. For all of us, the vaccine means hope. It also means employers and human resource experts are in a unique situation. All of us may have questions that have really never been asked before, at least in 100 years. For example, can you mandate all employees receive the vaccine? If vaccines are required, what are the options for administering them? How can you work with employees who choose not to get the vaccine or who are not eligible? These are just some of the new questions that we are asking in a time like no other. As Neil said earlier, we're pleased to partner with our experts today to give you the answers and additional resources that you need to help guide your business. Make sure you take notes if you can, but if you can't, don't worry, because we will share a recording of this presentation in its entirety on the KC Chamber's social media channels and our YouTube page. So it's my pleasure to introduce our two employment law specialists for this morning's conversation. First, Anne Baggott. Anne is a member of the Society of Human Resources Management of Kansas City's board, and she's also a shareholder and director with Dysart Taylor. She's an experienced employment lawyer with a blend blended practice representing both companies and individuals on all aspects of employment law, and she advises and strategically guides businesses through the complex web, and it is a complex web, of workplace laws. And as you can imagine, since March, she's been working with companies of all sizes as they deal with the multitude of issues the pandemic has brought to all of us in the workplace. I'd like to introduce John Vering, who's a member of SHRM as well, and a shareholder with Seigfreid Bingham here in Kansas City. John is the senior labor and employment attorney in Seigfreid Bingham's employment law department. He's been recognized for employment law expertise by Best Lawyers in America, Missouri, Kansas Super Lawyers, and Chambers and Partners, America's leading lawyers for business for over 10 years. And he's a member of the College of Labor and Employment Lawyers. And this is significant. In 2020, he was recognized by the Kansas City Metropolitan Bar Association as a Dean of the Trial Bar. Anne and John will begin with the presentation, and then John Murphy, who so many of you know, the former chairman of Shook, Hardy & Bacon, will lead them in a discussion to answer as many of the questions you have as we can get to. And you'll be able to submit those questions via the chat function, and then we'll do our best to answer as many as possible. So welcome to Anne and John. The virtual floor is now yours for the conversation this morning.
Thank you, Joe.
I'm going to begin this morning, and I'd like to make a preliminary comment, and that is that Anne and I are providing to you the best information that's currently available, but bear in mind that the law and the guidance with respect to COVID vaccine is changing on a daily basis, and we're going to have time just to cover the highlights today, and we do encourage you to get legal advice from the counsel of your choice, and remember that the advice and comments we make today may be outdated a week, a month, or several months down the road when this vaccine actually becomes available. As I'm sure most of you know, there are two vaccines that are currently authorized, the Pfizer and the Moderna, under an emergency use authorization. Next slide. The distribution of the vaccine is made by the United States government to the states, basically on a population, primarily a population basis, with healthcare providers and long-term residents and patients getting the first shot at the vaccine. Next slide. Here is the Kansas vaccination process, and Kansas is in phase 2, but Kansas is unique in the sense that it allows each county to make their own policy choices in terms of who gets the vaccine first. So for example, in Wyandotte County, persons age 65 and above are not generally eligible yet for the vaccine. Rather, Wyandotte County is focusing on persons who have contact with the public, such as teachers, police, grocery store workers, bus drivers. Actually, one of my son-in-laws is a bus driver, and he got his shot yesterday. But my daughter, who lives in Wyandotte County and a teacher, is eligible but hasn't been able to get the shot yet. Johnson County, by contrast, is allowing individuals 65 and older, as well as essential workers, to get the vaccine. So it just depends on the state that you're in. Next slide. Missouri has a somewhat similar system. They're in phase 1B, but the people that are now eligible in Missouri are first responders, emergency service, and public health infrastructure, and high-risk individuals 18 to 64, and individuals 65 and older. So a slightly different policy choice in terms of who gets the vaccine. Next slide. Public response to the COVID vaccine has been, it certainly overwhelmed the supply of the vaccine, but there's some surveys that have been conducted that I think are important for you to know about. 60 to 70% of the public is willing to get the vaccine, but there's a 15 to 30% that is hesitant. Some of that group is willing to be persuaded. They just don't want to be in the first group. It's important to know who are the individuals what groups tend to be more hesitant about getting the vaccine. They're Republicans, people ages 30 to 49, individuals who live in rural areas, African Americans, Hispanics, people with a high school education or less. The reasons given are it's a personal choice, COVID has been overblown, concerns about the side effects, distrust of government, distrust of the speed of the vaccine development, a fear of getting COVID from the vaccine. The people that are most anxious to get the vaccine are worried about their own health or that of loved ones, and tend to have an attitude that it's everybody's responsibility to protect the health of others. And to the extent you're going to encourage your workforce by trying to capture, we're part of a team at this workplace, we need to be concerned about the health of our co-workers. Also, it's important to know who people trust for advice about vaccine, and the person that is trusted most is the individual's own doctor. Why don't we go to the next slide? There are employer liability concerns. There was some talk about some kind of general liability protection for employers at the end of last year, but that did not get passed. There is some limited FDA law that would provide liability for torts, somebody that gets injured or in an illness because of the vaccine. That's generally limited to employers that are administering the vaccine either directly at their workplace or through another, and it requires strict compliance with the emergency use authorization. And that authorization specifically states that every person has the right to refuse the vaccine. So when we talk about mandatory vaccinations, we're talking about a mandatory vaccination as a condition of employment. You can't force anybody to get a vaccine. And I will say as a general rule that most employers at this point in time are encouraging rather than requiring the vaccine. Anne, I'll turn it over to you.
Thanks, John. So as John mentioned, employers are in a really tough position right now. They have a lot of choices to make based on what their employees are willing to do. And based on the industry that they're in. As John said, there are lots of common employee objections, fear of adverse reactions, etc., particularly because both of these vaccines are only approved under the emergency use authorization at this point. So as the next slide shows, the employer's options at this point are generally the quote, no policy, to institute a mandatory vaccination policy or to institute a voluntary but recommended vaccination. And as the next slide shows, the employers, each one of you on this call, you have a decision to make. The process that you need to go through will require a lot of thought. Many of the healthcare providers who may be on this call or healthcare organizations as a whole maybe have gone through this already. General employers, you need to go through a process. So that's going to require an assessment. One thing you can do is to kind of network within your industry, find out what your counterparts are doing. John and I discussed this, and we highly recommend that you anonymously survey your employees on the front end while your decision-making process is happening. Find out who plans to get vaccinated or the numbers of people who plan to get vaccinated. What are some of the possible objections? Identify those incentives that would be attractive to vaccination if you need to go that way. You should definitely get key input from your stakeholders, including operations, legal, etc. And where appropriate, get advice from your HR consultants and legal counsel. And if we can move to the next slide, for various reasons, an employer may decide to have no policy and truly leave it up to the employee to decide on his or her own whether they want to get vaccinated. But you should be conscientious and aware that the no policy has some risks in any event. So every employer has a duty to provide a safe work environment. So even if you don't have a policy, you still need to take all reasonable steps that you can in order to keep your workplace safe. So if it's completely up to the employee about whether to get vaccinated, highly recommend you continue to follow the interim guidance on safe workplaces for COVID-19, PPE, hand washing, distancing, etc. We do expect OSHA under the new Biden administration to present us with some new guidance on vaccinations and whether OSHA has any recommendation or even regulations down the line about the vaccination process for employers. The next option that many companies are considering, or that you could consider, is a mandatory vaccination policy. In my experience of working with companies, this is the route that most are honestly not taking, because there are so many risks, frankly. There's so many things that you have to watch out for if you make vaccination against COVID-19 a condition of employment. But you can do it, and that's kind of the bottom line. You can have this policy with some caveats. So, in general, the caveats are to allow for accommodations for employees who need a disability accommodation or have a religious objection. So the things to watch out for are Title VII and ADA considerations. You also, moving on, the other considerations are for workplace safety. Again, under the mandatory vaccination policy, if an employee has a reasonable belief that the vaccine creates a real danger of serious illness or death, OSHA does not allow you to retaliate against that employee. So you have to be conscious of that even with a mandatory vaccination policy. There are other risks with this policy that come with you requiring the employee to get vaccinated. So if you have a mandatory policy, the vaccination itself is going to be considered conduct at work. So if you're injured from receiving the vaccine, so you have a serious side effect, that will absolutely implicate OSHA. You would have recording and reporting obligations under OSHA. It could also implicate, again, if the employee has an adverse reaction to the vaccine, it could implicate workers' compensation. They were injured in the course and conduct of their work, so that the employee could seek workers' compensation benefits. Moving forward, again, I mentioned if you decide to institute a mandatory vaccination policy, you do need to allow for exceptions for a religious belief. So the EEOC has issued guidance. This is not new guidance, and it's been around since employers have been considering vaccinations, particularly in flu vaccines and influenza. The employee could get around the requirement of a mandatory vaccination if they have a sincerely held religious belief that would prevent them or bar them from getting the vaccination. Again, that's if the employer requests that, it's going to require the interactive process. And there's information that the employer can ask if the employee raises that objection in order to clarify and substantiate that the employee truly has a sincerely held religious belief. And assuming that process confirms that there is a sincerely held religious belief against being vaccinated, generally the employer is required to accommodate that unless the exemption itself creates an undue hardship to the business. So another area that if you have a mandatory vaccination policy would require consideration is if the employee has a medical condition or a disability that would prevent them from getting the vaccination, or make it really risky to their health to do that. So again, it requires the employee to request an accommodation to not get vaccinated. And generally, again, requires the interactive process as you would with any kind of request for an accommodation. So, and the accommodation is generally required under this mandatory vaccination policy unless the accommodation causes an undue hardship or a direct threat. Again, undue hardship is causing the employer significant difficulty and expense, and a direct threat is if there's a significant risk of substantial harm to the employee or to others that can't be eliminated by a reasonable accommodation. It's going to be very, very individualistic and fact specific. Go to the next slide. As if you have a mandatory policy and you are looking into examples of accommodations, there are lots of ways that you can still accommodate the employee's objection while keeping them employed. Again, these statutes overall have a policy of keeping people employed. So numerous ways: remote work, extra PPE protection, social distancing, leaves of absence even could be one way to accommodate a request. There are resources online. I've given you a link in this slide. And I'm going to turn it back over to John now to consider the voluntary vaccination policies.
Thanks, Anne. Many employers are going to be going the route of encouraging vaccination. And how do you do that? One of the most important things is to develop a communication and education strategy consistent with the advice from the CDC and other public health agencies, virtual town hall meetings, having communications in writing and from supervisors. A suggestion I'm making to clients is that you have a point of information at your organization, maybe in HR, that is going to be able to tell employees, how do you sign up? And because it varies from where they live, how do you sign up for the vaccine? When it becomes available, you may be signed up, but you may be able to latch on to a particular website and get it sooner. Put that information on an intranet or SharePoint. Have senior management in the company involved in the communication process. Have those individuals committed to take the vaccine themselves when it becomes available for them. Next slide. Other things that you can do, the easiest thing is to say, okay, we're going to give you PTO time off to go get vaccinated. And if you have an adverse reaction, we're going to allow PTO time extra to cover that. Some companies are saying we'll give you 4 hours off. That's a choice. Some companies are giving cash, gift cards, enter into a drawing to win a TV or a gift certificate. All those are options. Some possible problems with those: someone who's disabled, for example, could say, well, I don't have the opportunity to earn that incentive. A way to address that is to say, well, if you can prove you can't get it because of a disability, we'll let you do something else. Maybe you'll get a couple of COVID testings. I've had the vaccine and I'd much rather have a shot in my arm than have those swabs up my nose. Saying to someone, well, we're going to do temperature checks on you if you can't get vaccinated. There are some new proposed EEOC wellness regulations. They're not law yet. Nobody knows even if they'll apply, but it's just something to keep in mind. Next slide. One of the things that Anne and I have done is we have on this slide and the next slide links that you can go to be able to find out where you can get vaccinated or who the contacts are to sign up for vaccination. Next slide. Who pays for the vaccine? Either the federal government or insurance companies. If you're going to require vaccination, you're going to have to pay the people for the time they spend to get vaccinated. If it's voluntary, you don't have to pay them, but it's probably recommended for many employers. If you got a union, you got to negotiate with the union probably. think about your temporary employees in addition to your regular employees. Next slide. We've got a resource here. The second link is to the EEOC guidance, which I highly recommend that every HR person or person wanting to understand what the EEOC rules of the road at this point in time are. Click on that and read it. There's also some other valuable information about COVID and ADA and other laws. Next slide. The second item, second link on this slide is a very recently reduced CDC toolkit for essential workers, but it can really apply to any workers. It is incredible. They've got sample letters to employees, a sample PowerPoint to educate your employees, frequently asked questions for employers and employees. Just a tremendous resource, which I'd encourage everybody to take advantage of. And I think at this point, we're ready to turn it over for questions and answers.
John and Ann, thank you so much, and hopefully you can hear me. As you probably anticipated, we have a number of questions. One I think is unique to our position along the state line. And the question was, if you work in Kansas, but live in Missouri, but are considered an essential worker, are you eligible to get the vaccine in Kansas? Figured we'd start off with an easy one.
Right. In talking with my clients, they've also faced that question too. And again, right now, primarily healthcare providers who are able to get the vaccination. And what they have done is register or sign up in both states. What my clients have been telling me is that the vaccinators are not really, they just want shots in arms. So if your goal is to get your employees vaccinated as easily and quickly as possible, and you have that state line issue of where you could possibly be eligible in Kansas or possibly be eligible in Missouri, sign up in both and get vaccinated as soon as you can.
And Ann, sticking with you, because you talked a little bit about the undue hardship and direct threat issue, what recourse does an employer have if an employee chooses not to get vaccinated, gets exposed multiple times, has to go through the quarantine period multiple times, and all of which has a negative impact on workplace conditions? What can the employer do in that situation?
So, it's really complicated right now. What we put in our information in our presentation, John and I said, you really do need to be flexible. How you treat an employee at the end of the day will come down to whether you have no policy, a mandatory vaccination policy, or a voluntary vaccination policy. The undue hardship and direct threat analysis really only comes into play if you have a mandatory vaccination policy in place. And you go through the interactive process, reasonable accommodation, and that whole decision-making, that whole thought process. If you have a voluntary policy or no policy at all, you have to look at the needs of the business. At the end of the day, can you fire an employee just for simply refusing to get a vaccination? Yes, but you can kind of sense my hesitancy there with that answer. You've got legal risks. Is there retaliation? Frankly, you have a practical issue too. If you do fire employees for not getting vaccinated at this point, you could have a public relations issue. It really is, it is complicated. I do think that as the vaccinations become more widely available, it will sort itself out. Our goal is to get our economy back to as normal as possible. I think it's going to take some time, and the employees themselves will also, as they feel like they're not the frontline guinea pigs, people will be getting more and more vaccinated and we'll get more and more back to normal. So it's just going to take time to do that.
Okay. John, one of the questions was, and there's going to be two parts to this, and that is, are there suppliers out there that the employer can contract with to come on the premises and give the vaccine? And I guess the corollary to that is I got my first shot 2 days ago, and one of the pre-screening questions was, did I ever have an adverse reaction to any other vaccine? If you bring somebody on site and contract with them, and that pre-screening question is asked, does that bring in the disability inquiries under ADA into play?
Yes, it would. Yes, it would, because if you're contracting with someone and they're on site, they are you, they're your agent. I think you would need, it doesn't mean you can't ask the question. It just means you need to make sure that it's treated like any other medical question under ADA, that be kept in a separate file and not be used for any purpose other than determining whether they can get the vaccine or not. And what was the first part of your question again?
And that is, are there suppliers that you're aware of that will contract with employers if that's the route the employer wants to go?
I'm not certain of that, but I have been advised that in Wyandotte County, for example, that they're encouraging employers to, quote, sign up with the county, I guess, as a group. You know, we want all the bus drivers to sign up, and I don't think that is. I think that's through the county health people, not going out to a private company. But there may be some that I'm just not aware of. Anne, are you aware of any ability to contract with a private company?
I'm not aware of that right now, just because of the limited supply of the vaccine. And my understanding is that all vaccinations currently are going through public health departments or hospitals, where the public health department has provided the hospital or healthcare organization with vaccines that are available to the tiers of people who can receive it at this point. Again, there's so many unanswered questions about these vaccines. I expect at some point that there will be vendors that you could bring into your workplace to get your employees vaccinated, just like many of us do right now with the flu shots.
Do you have a recommendation, either of you, either way? Would it be better for an employer to recommend to their employees to go to a pharmacy or go to a hospital as opposed to offering the vaccination on site?
I think there's less quote employment risk if you send the employee to Walmart or CVS or whatever, because you're then not asking any medical questions. But you have to balance that against the convenience of having somebody come on site. And just like, the flu vaccine, I think employers have it on site because they think they'll get a much higher percentage of people taking the vaccine if they make it very convenient. Anne, do you have a different thought?
I don't have any different thought. Unless you are a hospital or other healthcare provider, my only addition to what you just said, John, is that it'd be really, really hard for you to administer the vaccinations yourself. I mean, you've got to be licensed to administer vaccines as a doctor, pharmacist, nurse, et cetera. I think that those roles are expanding. So if I can make any recommendation on this at all, it would be to hire a vendor to come in when those folks are available.
Assuming someone gets a vaccine, claims an adverse reaction, and seeks additional PTO, what type of documentation can an employer ask for to verify that?
Well, I think you could ask for documentation, but I don't know that I would really recommend it. I think typically the reaction is, 1 or 2 days, and telling your employees you've got to go to the doctor's office where maybe they can catch something. I mean, you could still catch COVID right after you've got the vaccine. I think there are some employees that would probably take advantage of you as an employer. And, that's a decision you're going to have to make. Do you trust your employees or not? I think legally you could ask for some kind of documentation, but if it's only going to take a day or two, whether they can get into an emergency care facility to get you the documentation, I think would be a real challenge. And I don't know that I don't think I would recommend it.
There was a question in the chat, and then there was also, I think, some questions submitted even before we started today, and that is about different classifications of people. For example, where do educators fit in the phases? How should an employer treat an intern or a temporary or contract employee? Just for examples. So how would you respond to that?
Yeah, I'll take a first stab at that one. So whether educators, what tier educators fall into is really going to be state specific and maybe even county specific. So it just depends on where the person is employed. I do know that generally they are going to be considered critical workers, but again, if they're in tier 3 or tier 2 or tier 1B, it's going to vary. So you do want to look at the resources, the informational resources through the public health departments to know where your employees are in the tier system. John, what was the second part of that question then to follow up?
I'm trying to remember. We'll
yeah,
get back. We'll get
sure.
back. And all right, here's a tough one. What's your time frame prediction for when the Kansas City metro area will reach herd immunity through vaccinations?
Man, if I were a doctor, I'd have a really good answer to that. It really is just going to come down to the amount of vaccine that we get in this area, which is driven by supply throughout the country and what Pfizer and Moderna and any other pharmaceutical companies can supply. There was a question, I think, about PTO, do you need to pay the person if they're sick after getting the vaccine? I wanted to add to that, if I could, for just 1 second. What John and I are talking to you about really is limited to Missouri and Kansas, where we straddle the state line. So if any of you are multi-state employers, you're going to have to check your particular states, because there definitely are other states that are requiring paid leave for COVID related reasons at this point, even outside what we had in 2020 under the FFCRA. So you want to check your local jurisdiction, but what many employers that I've been talking to have decided to do, and part of their education and communication piece is say, we want you to get the vaccine. We are automatically going to give you a day of PTO after your second dose, or whatever you structure that, however that works for your business. But that is something employers are doing outside of anything that they're required to do. Again, it's part of that encouragement to get as many employees possible vaccinated.
And
John, I think your earlier question, you have an earlier question about temporary employees, and I do think those are important, and it may depend on the contract you have with the temporary agency. But I think if you have a temporary worker working alongside a regular worker, they could certainly communicate the COVID virus. And so I think encouraging those people, I know that some organizations, healthcare organizations, have rules that say an independent contractor that comes in here has to be vaccinated. So if you've gone down the road of mandatory vaccination, depending upon your contract, you may say to the independent contractor, if you're going to come in here and work, those employees are going to have to be vaccinated as well. So maybe that helps address that question.
Thank you for remembering what I forgot. And actually, there's a corollary to that. What if you have an important client or an important customer and they require proof of vaccination before you can enter their premises? How does that impact you with respect to your employees getting the vaccination?
I mean, I think as with any decision-making process in working with with clients. If you want to keep that business, you're going to do what you can to keep it. And so if that vendor, client, business that you're doing business with requires vaccination to enter the premises, I would think that what you would need to do is you may have to adjust the connection, you're the relationship person with them to give the client or the vendor what they need. If that's necessary, if that's a necessity, again, it's a business decision. And so if John is refusing to get vaccinated, but it's not a condition of employment at your business, but widget maker, right, wants anybody to go into their business to be vaccinated, then instead of having John be that connection, have Jane be that connection instead, and just do what you can to keep the business.
Thanks, Ann. John, anything to add to that?
No, I think that covers it.
This is a timely question, I think, given just the last 48 hours, and that is, with respect to concerns about the new strains of COVID and the potential that the vaccine may be less effective for those new strains, or in the case of Moderna, you might need a booster shot that they're looking at. How do you encourage employees to take a vaccine that is already being suggested in the media that might not be as effective as originally thought?
It seems to me you just have to educate your employees. What I'm reading is that, they think it will be effective, if not 100, if not 95%, it will be somewhat effective, but that poses a real problem. One other comment I'll just add, kind of relating to the last question, is if your employees do get vaccinated, I would encourage them to have documentary proof of that and furnish that to you, just for the reason that was mentioned. It may be needed at some point down the road with a customer, or maybe, useful information to have. And the EEOC current guidance is proof of vaccination is not a medical inquiry. And so I think it's good to have. And also, I think it's good for the employee to be able to have proof that they've been vaccinated if they want to travel somewhere. When I got my first vaccine, all it was a little bitty of a card, which could easily be lost. And so I think encouraging employees to keep that record and have a copy with the employer would be a good idea.
And can that record be kept in the employee's personnel file?
I would put it in the medical file.
What I would encourage everybody listening in this is the Moderna booster vaccine came out literally yesterday. So, or that there may be a recommendation to get a booster shot for that vaccine. I mean, what we as employers can do is do our best to keep our employees educated as to current medical guidance. I mean, I'm no doctor, I'm not a part of a healthcare organization, but what I can do as an employer is put together resources to help my employees get vaccinated. Rely on and refer to CDC guidance, FDA guidance, local public health agency guidance. You're not the doctor, you're not their doctor, but as part of that education and encouragement piece that most employers are doing right now, again, putting together a list of resources about how and where and when you are eligible and able to get the vaccine is a really, really great way to get your employees vaccinated. So I've talked with several employers actually to get ready for today. And one thing that they are doing is either on their intranet or their SharePoint or whatever internal resource you have, put together a help page. Again, but it needs to be consistent with public health agencies. And I've also talked with several organizations, and they really say, if you want to have a higher percentage of vaccination in your organization, it really needs to start from the top. What are the communication pieces from the top down? I mean, just like with our own country right now, I think seeing Kamala Harris being vaccinated and getting her second dose on TV is a big signal. And just like in all of our organizations, if we see our leaders doing it and encouraging it, it will flow down.
The other comment I'd like to make is I think encouraging employees to check with their own doctors, because I think most physicians will recommend it. And there are a number of gray areas. For example, someone who's pregnant, should you get the vaccine or not? Someone who has had cancer, should they get the vaccine or not? I think encouraging them to check with their physician, since the surveys show 85% of the people trust the advice they get from their own doctor. Also, as an employer, you don't want to be, unless you're a healthcare provider, you don't want to be playing the role of doctor. You can make recommendations based on what the public health people say, but I think to the extent you can encourage them to see their own doctor, seek out their own doctor's advice would be advisable.
At this point in time, if you're in a workplace where all your employees have been vaccinated, does that eliminate the other safety recommendations that the CDC has made with respect to social distancing and PPE?
Again, this is it. We don't know. We don't know how long the vaccine will protect us. We don't know if a vaccinated person can still be an asymptomatic carrier. And so what public health agencies are recommending is that even if you are vaccinated, you continue to comply with those precautions that we've been doing for nearly a year now. The mask wearing, the washing, the social distancing, all of that. So again, I'm going to be, and I know all of us on the phone on this call are going to be paying attention to what the CDC and our vaccine manufacturers are telling us as the data develops on that. But right now, you still need to be protecting yourselves in other ways.
And I might add to that, right now, the mask ordinance doesn't have an exception if you've been vaccinated. So I think legally you'd be required, at least for the time being while it's in effect, to at least comply with the provisions of the ordinances that are in effect in the various jurisdictions.
Go ahead, Ann.
So one other little tip. I work with a lot of small businesses, and very often it's an HR department of one. So you might look at, for folks in that situation, you might look at healthcare organizations' websites. Various hospitals are actually putting together their own COVID resources that have links to the different public agencies in Kansas and Missouri. So you don't have to reinvent the wheel by getting these education pieces out to your employees. Look at some resources that have been put together by frankly, by hospitals at this point. That's a good way to start too.
Somebody raised the question as to whether or not encouraging employees to turn in vaccination cards to their employer, does that open the employer up to harassment claims?
I don't think so, as long as it's, encouraged. As a matter of fact, I don't know why you couldn't require it. And if somebody doesn't turn it in, or somebody, they ought to be kept confidential in a medical file. So I don't think it should be widely distributed as to who's turned it in or not. Anne, do you have any different idea?
I don't, except that we're in such a polarized world, we are. And if your employee population is really divided, then knowing that somebody is vaccinated at this point could be viewed to someone else as a political statement. And I hate that is the situation now. But if that happens and somebody is actually harassing the other person for getting vaccinated, it could. I don't think that the mere submission of a vaccination card, which will be kept private and privately stored in your medical file, would be harassment. As with all harassment situations, it's going to depend on what employees do after that. Are there negative comments, about the fact that you got vaccinated, which again will come down to or impact other considerations, political speech, that kind of thing.
During the course of this morning, we've sometimes referred to critical workers and other times to essential workers. Are those terms interchangeable, and are they both referring to the CISA designation?
John, to be honest with you, I think you have to look at each state has their own definitions of who fits in those categories. And so it's kind of to me, a general term, and you really have to look at the particular locality, maybe even to the county level of who they are considering, critical and who's not. And there's a reference in the chart to, congregate settings, which can be jails or, long-term care facilities. And so there's some definitional issues that I think have to be looked up on a local basis, to the best of my knowledge.
In the event you have a mandatory policy and the employee refuses to get vaccinated, are they eligible for unemployment?
Again, that will be a state-specific determination, but whether you are eligible for unemployment comes down to whether the termination was due to misconduct connected to work. I've had the misfortune of having to work with many, many clients on unemployment claims in the past year, more than I ever have. So kind of, I'm sad, honestly, that I know so much about unemployment claims at this point when I never have before. But my sense, again, it's going to be up to the unemployment boards to make that decision. But my sense is that the unemployment board will not determine that a termination due to a refusal to get vaccinated is going to be considered misconduct connected with work that would disqualify the employee from benefits. And that would take it, if the employer wants to contest the unemployment benefits, they would have to submit evidence and documentation to contest it. But again, that's going to be a developing area. It certainly is not developed very well right now because most employers, frankly, are not adopting mandatory vaccination policies. So they're leaving it up to the employee while encouraging them, but something we'll be watching out for also.
With respect to accommodations, somebody asked if a work task has to be adjusted based on vaccinations, is the employer permitted to adjust the employee's position or work status?
Well, I think as a general ADA matter, if I have a job that requires lifting 50 pounds and it pays $20 an hour, but I can't do that job anymore because I've got a bad back and can only lift 25, and that puts me in a job that I only earn $12.50, I think that's permissible generally under the ADA. So I think if someone had to be moved to another position, lower paying position, because that was a reasonable accommodation, then it would seem to me they could be moved to a different position, even at a different rate of pay.
Anne, anything to add to that? Or
I absolutely agree. Again, the policy behind these employment rights statutes are to keep people employed. So if that means moving somebody to a different position as an accommodation, I think that's a good solution. Somebody who maybe is a front-facing retail worker, is there a different position that person could move to? Are they qualified to do that job in order to keep them employed?
And in that regard, if you have staff who chooses not to get the vaccine, and they continue to get sick, and they miss work for COVID, etc., what degree can you coach them to be safe out of the workplace to keep the virus from coming into the workplace?
That I've gotten that question quite a bit actually from my own clients at this point. And my advice, pretty much overall, unless there's some sort of wrinkle to the situation, is that you can require your employees to comply with your attendance policies. At a certain point, it is going to be a problem where the employee is continuing to put themselves at risk, engaging in behaviors that require them to, quarantine every month, isolate. You put that aside, put aside the conduct and just focus on the impact it's having to your business. You're not here. I'm not able to get the data entered, that you're supposed to be doing. And so at that point, I think it's fine to counsel, again, because you're looking at your attendance policies and the impact it has on your business. I would be flexible for sure, not do it automatically. It needs to be a habitual problem before you get to discipline, because my mantra for nearly the past year has been be flexible. You need to be flexible with your employees, but once it does hurt your business, absolutely, it doesn't matter that the person is quarantined because of COVID or sick, or you can require compliance with your attendance policies.
Okay, we have time for one more question. I'm going to give it to you, both of you, for 30 seconds each. Should we be optimistic about the vaccination program as we move forward? Anne, you want to take it first, then we'll close with John.
I mean, I can only answer from my own personal experience and in talking with my clients. Absolutely. I am 1,000 times more optimistic than I was even 6 weeks ago with the approval of these vaccinations. And as they get more and more widespread and available, there's every reason to be optimistic. And I'm really excited about that.
John?
I'm equally optimistic. I think people are excited about the vaccine, and I think the more people become educated and realize the benefits of it, the better. And I think there'll be, I expect even at the Super Bowl, there'll be, public information about how important it is to be vaccinated. And I think, not to get into politics, but I think our administration is moving in the right direction of encouraging, to the extent possible, people get vaccinated so we can get our economy back going.
Well, that's a great way to end, both on an optimistic note and a reference to the Super Bowl. So, Anne and John, thank you. This was a great presentation. And thanks to all of our attendees as well. They were very thoughtful questions. And we hope you're able to come away from this with information and resources that will help you support your employees and your workplace. And I also want to thank the partners on today's event, KC Rising, the Civic Council, the Chamber, the KCADC, the Mid-America Regional Council, and of course, the Society for Human Resources Management of Kansas City. All of these organizations are planning additional events and creating more resources that you may find helpful as you plan for the rest of 2021. Please make sure to check out the websites and keep an eye on their social media channels and stay updated. Thanks to all of you for participating today, and have a great day.